Hello. Hi everyone. Okay, am I audible and visible? Okay, we have here very inspirational guest today on AYG platform. I will just send him request to join. Request Dr. Rohit Sane. Okay. Great. Very fast we did. Wow. Uh, okay, let me introduce you. Actually, nobody need your introduction, sir. I'm so happy to connect here, and it's my actually pleasure to invite you, and you immediately accepted my request to join me on this live session, and we are discussing your favorite topic, that is heart health care. So,
Thank you. Thank
welcome,
you.
Doctor.
It was really a pleasure from my side that you have invited me. I'm absolutely happy to be with you on this Instagram live.
Oh wow, this is so good. I will note this date now that you are saying this. So it is one of the great compliment I can take it. And thank you so much. So Dr. Rohit Sane is having been background of MBBS, that is allopathic, but he has have decided one motive, that is integrating allopathy and Ayurveda together and serving in the healthcare and focusing mainly on the very important organ, that is our heart. So without wasting much time, you will see Madhava is the brand which has been now across the globe, which is present, and many research which has been done, and you have created a lot of job opportunity to Ayurveda doctor, and it's incredibly inspiration for all of us that what we can do, if we just take one idea and how fast we can spread, if that idea is just serving the humanity with the right approach, taking our ancient science as well as the contemporary science. So, sir, you are one of my indirect inspiration. Means your introduction is there on the internet. A lot of things are written, but I would like to share here personal experience. I heard you. You may not be aware about this. I heard you first time in the seminar that has been held, I think 2007 in Kalyan, I guess 2006 or 7 in Kalyan. Okay, that was before pandemic, and so many years passed by. And that time, first time I heard you, and you were speaking about CBC and all this hemoglobin and everything, that pathological aspect of this thing. So, and I was just listening you, and I don't feel distracted anywhere. I was just focusing on your talk, and you made so simple to understand that whole pathology that time. So that was memory which I carried along with me since many years. I never shared with you. Sorry, we met later on many times, but this is the right platform to share. So now, going ahead with the session, sir, please let us know how we can, take care of this heart. Recently, we seen that our popular singer KK, passed, and the way he has been gone, it's tremendously, shocked all of us. So let's talk on this.
Okay. According to me, see, I have learned my MBBS in learning my Ayurveda. I teach in a homeopathy college. So, having learned all these sciences, what I realized about heart health was, even though we read a lot about it, that improper lifestyle or a lot of addictions that people have, a lot of wrong habits of food people normally have. If at all we keep all these reasons improper for heart disease to come in, I think as per Ayurveda, it has been clearly mentioned that for a heart disease to start, the Rasa Vahini has to get distorted. And a clear, simple explanation has been given in Ayurveda that Chintyanam Atichintanat Rasavahini Dushyanti. So what we need to gather over here is, as per modern medicine also, as well as per Ayurveda also, the most important reason for heart disease to come in is nothing else but stress. Likewise, if at all we talk about any other disease, like for example, if at all we talk about diabetes, as you must be knowing, food is the most important reason for diabetes to occur. That is what has been explained by Ayurveda also, as well as been explained by modern medicine also. But at the same time, if at all we read about heart disease, Ayurveda has clearly mentioned that it's only stress which leads to heart diseases. And in my practical experiences, whatever have I seen, is any patient who has suffered heart attack in his past, if at all we ask him what could have been the reason of heart attack, it would be some kind of psychological stress that the patient must have undergone, due to which he had suffered that heart attack. So, according to me, when I've gone through this, all these whole science of heart disease in last 20 years, what have I realized is, yes, improper food, improper lifestyle, and all the reasons like addiction, diabetes, blood pressure, all these risk factors do have a reason for heart attack. But according to me, the most important reason is going to be stress. And if at all a person combats his stress very well, I am sure that he'll have a very, very healthy heart to come in the future.
Okay, that's really nicely explained. Now we will not talk a lot of causes. What we need to focus on, how we can calm down the person first. Work on the stress, and will be saved from these heart diseases. Okay. So now my next question is, what made you to think about focusing on this particular heart organ? Because we have many vital organ in our body. Why
True.
only heart?
True. There are 2, 3 reasons. One of those reasons is very, very important reason. I'll come to that reason at the end of this whole reason list. The first reason that I must have been driven towards heart disease would have been my passion towards having some kind of surgical hand that I had. So I was a topper in surgery in my MBBS, and I loved surgery like anything. And when I was doing my internship, I had done n number of surgeries along with my seniors, and I was one of the best intern while doing my internship. So I loved surgery like anything. As well, when I was doing internship, I was also a good emergency management guy. So any kind of emergencies, I would be the first to handle those emergencies. And after my MBBS, after my internship, when I spoke to my father, he said that you are supposed to do Ayurveda and not allopathy. So I had to leave all those things and come back to Ayurveda and learn Ayurveda. While learning Ayurveda, while changing over from allopathy to Ayurveda, it was a very, very difficult journey that I had to go through. And in this journey, what I realized was, whatever is your love, like my love was being into some kind of emergency management, some kind of surgical intervention. I continued to be with my love, even though I got into Ayurveda through the way of getting into some kind of intervention, treating a very difficult disease that was heart disease. These were 2 main important reasons. And the third most important reason, which changed the whole course of my life, was when my father suffered a heart attack in the year 2004. I was the emergency management guy with all the senior emergency physicians over there. And for those 17 days when my father was in literal coma after this heart attack, He had a renal failure. He had two more MIs in those 17 days. And I was trying to get him out of the whole scenario, but I failed in those 17 days. And the end of 17 days, I lost my father. There is where I realized that all these emergency techniques that I was trying to do, it was too late for him to get onto these emergency techniques. There is where I realized that there should be something more than these emergency techniques, like preventing a person to get into the whole zone of being into emergency management. There is where my father, when he left me, there is where I realized that I have to do something more than what I have done for him. And that was nothing else but getting into preventing heart disease. When I lost my father, I had two options in front of me, either to blame the doctor or to blame the hospitals, like all patients normally do. And the second option with me was to fight against the disease which had killed my father, and that was heart disease. And hence, I took an oath at that moment itself that if at all I am not able to save my father, I'll be spending whole of my life to save all those fathers in the whole world who are literally fighting against heart disease, and their families want their father back healthy and alive. And that is what my life is spending for, the whole life that I'm spending for. So that is how I entered into heart disease. From there, I started learning heart disease once again in 2004 till 2006. And whatever I learned in those 2 years is all what Madhavbhag is all about. Hence, I'm into Ayurveda and into cardiology from then on.
Wow, that is too personal, and you have made the purpose clear after that. Actually, that's what make us those difficulty or problems. What we see that it is a problem, but that only leading us towards our purpose. Similarly, that reminds me even my own goal. Currently, I'm doing this prenatal, postnatal yoga and Garbha Sanskar courses for training the health provider and all that. So people ask me why you took this particular thing, because even I have my closed one, like my sister, who have gone through a tremendous painful experience of conception and then missing, you know, abortion happened in front of me. Being a doctor, I'm helpless to do anything, like you have shared. That's why it just recollected me how I was standing helplessly in the labor room, and that doctor is, taking out the dead piece of life. So this is really painful, but again we have to, life should move on, and that's how we go ahead. Okay, let's go ahead with the next question, that um, when one should start taking care of heart healthcare, what is the time
Okay.
you recommend?
No time is late. The day you realize that your heart is very, very valuable, that day itself you are supposed to start with taking care of your heart. Now, what happens is many a times when patients come to meet me, I normally ask about which car or which vehicle do they drive. Normally they answer me like they drive maybe some four-wheeler or some two-wheeler. And then I ask them, do you normally add some kind of kerosene or some kind of gasket to your normal petrol tank every day while adding other kind of additives to the petrol that they normally fill up their tank? Normally they say, no, we don't do that because that will unnecessarily damage my car. There is where I ask them that now you are supposed to think about this, that if that car which you have bought for few lakhs and you are taking care of that car to such an extent, this human body and this human heart which you have got free of cost, but it would lead to n number of problems if at all you lose your heart, and you would lose n number of rupees that you must have had a good amount of income in last so many years. You would lose it in a few seconds if at all your heart goes into a problem. There is where the patient realizes that I'm supposed to take care of my heart. And according to me, no age, no time is late. Even though you realize after a heart attack that I am supposed to take care of my heart, that is the right time. even though you realize the same at the age of 14 or 15 or 17 or 20 or 50 or 70 or 90, that day where you realize that this is the right time that I'm supposed to take care of my heart, that is the right time. No time is going to be late, because treating a heart disease is not so difficult. Whenever you realize that it's my heart and I'm supposed to take care of my heart, that day becomes the best day of your life, and you can start taking care of your heart immediately. So no day is going to be late.
Absolutely, doctor. That's really great, answer. And I feel like I heard about that fetal originated adult disease, FOAD, FOAD. So that took me, the time, which because it is very much related to my subject. So I always tend to fall on that particular topic, that is fetal heart care. If we just take care of pregnant women or before conception, if you prepare a couple, to first work on their own body and then go ahead with the conception, and that's the way you are creating when the organs are developing, that time also you can work on, and that's the way we can strengthen. So what is your view, being an
Absolutely.
expert?
No doubt about it. I would recollect my quotes in the past few years. I used to have these quotes like, allopathy is still struggling to understand when the fetus is developing what is the genetic composition of an individual organ, that is the heart. Many a times, modern medicine has failed to understand what chromosome has led to formation of this heart. But Ayurveda has clearly mentioned that heart is a matruj avaya, so it should be having X chromosome derivation for the heart. That is very clear from Ayurveda. And obviously, I am sure that in the coming years, modern medicine will be agreeing to this point also. Now, what do I come to over here is, if at all this has been clear that Matuj Avaya is your heart, that means the heart is so important in our body that we need to take care of this heart from the day we are born. As a very important point, that many researchers have already quoted this, that if at all a kid, whenever it is born, at that time the size of the heart, the weight of the heart decides whether the heart would be having any disease in the future or not. Many researchers also mention that the size of the lungs is going to decide the longevity of your life. The heart develops in the fourth week itself, intranetal, and that is the most important sign. So according to me, taking care of the heart while the female is pregnant, from that day itself, if at all the female becomes aware about the newborn is supposed to have a beautiful, healthy heart, at that moment itself, if all the female starts taking care of herself as well as her kid, that is going to be the best thing that to happen, because Madhav Bag's mission is to have a disease-free India in the coming future. And this is going to make our job very, very easy, because if every mother starts taking care of her kid before birth itself, it is going to be an easier job for us to make our nation free from heart diseases in the future.
Yeah, sir. Because there is a beautiful concept that when mother is pregnant, she is called in Ayurveda as a Dav Hrudaya, So
Absolutely.
Dav Hrudaya is the desire which she has, during that particular months, After crossing third month, then fourth month has been given more emphasis on heart development. And during that period, if we take care of her emotion, her state of mind, that will definitely give rise healthy heart, foundation for that developing healthy heart. So good to know. And good to know about research. Mainly what we are lacking in Ayurveda is evidence based, research. Whatever we are saying, okay, they actually, as per my study, we don't need to, do research, because what a scientist, sages have done more great job. We don't need to prove. But even then, there are a lot of people who ask you question, and to answer them, we need to always go back and check that with your pratyaksha jnana. So there is a shabda gyan, that what sages have said, and then we need to make assumption, and then we also tally with the pratyaksha. So that is how we do this. Okay. So, doctor, another question is it possible to take care of heart without taking or consuming any pills?
Absolutely, yes, no doubt about it. For a heart to be healthy, no pills would be required at all. If at all you are determined that you are supposed to take care of your heart without any intervention, that is surely possible. Like I normally mentioned in the earlier part of our interview, that chintanam ati iti rasavahini dushyanti. If at all you are supposed to take care of your heart, you are supposed to stay a stress-free life. If at all you do that, your heart would be absolutely healthy. Now, many people normally do ask me that how am I supposed to stay stress-free in my life? The answer is very simple. God has sent us only for two jobs on the earth. The first job is either vichar or the second job is achar. If at all I keep on thinking, vichar would be thinking. If at all I keep thinking, I would always be in some kind of stress because thoughts keeps you away from actions. But if at all I am continuously in some kind of action, I would have no time to think and that would keep me stress free. Hence, if at all anybody wants to be stress free, just continue acting on whatever you want. Don't think about whether this is right or whether this is wrong, whether this is apt or whether this is not. Just keep on acting because wherever and whenever you act, it's your job to keep on acting. Whatever fruits that you're going to get out of these actions has already been decided by him. We are just supposed to keep on acting and stop thinking. A human body is being made to act. It is made to work. It is made to keep on running. And if at all you keep on doing this, you would live a stress-free life. If at all you have a stress-free life, you would never enter into any kind of heart disease. And along with this, if at all you try to put some thoughts onto your food history that you normally consume, and the second is going to be on your exercises, that is again going to be some kind of action. So three things very, very important to keep your heart healthy. The first one is going to be the food that you consume. The second one is going to be the exercises that you do. And the third thing is going to be your stress-free life. So if at all you continue to do these three things in your life, no pill would be required to keep your heart healthy. Nowadays, people normally believe in some pills like having statins, having drugs which would be helping the blood to keep thin, like ecosprin and all. I believe that every human body already has a free of all the drugs that are being manufactured in the laboratory. Like for example, you could, and if at all, as an example, I would rather like to give, in case of an heart attack, when a patient has been administered with an injection of streptokinase or urokinase, this is an enzyme which has already been manufactured by a human body, has been thrown out in the urine of the human body during a heart attack. So this is nothing but the urokinase that we normally use for a heart attack treatment. So the enzyme which was already produced by your body, that means your body knows how to fight against all these problems. Hence, no external drug would help an individual to improve his heart health except having these three strategies. One is going to be your food that you consume. Second is going to be the exercise that you perform. And third is going to be a stress-free life. And these three things, if at all any individual continues to do, I'm sure that he would not enter into any kind of heart disease at all.
Okay. So that's really great that you said achar and vichar. And here you are emphasizing on achar, right? Action, you mean to say. So to add to that, in yoga, we say that skillful action, yoga ha karmasu kaushalyam. So if you are not trained to do exercise, you can also do this yoga, because yoga will teach you skillful action. Because
Absolutely.
just doing action, we can't live without action. being born in human body, we consist knowingly or unknowingly in action. But if you connect with your consciousness, connect and do the action with skillful, I think that will help us. So thank you, sir. Now the next question. Uh, okay, how to strengthen this whole support system? Like recently, we seen the, like I mentioned earlier, singer, popular singer, Indian popular singer, KK's death, and it is all in front of us. How he died. He just done so nice performance as usual on the platform, and then suddenly been feeling so much uncomfortable, and then so many people are around him, but still nobody is able to get that moment to take him, instead of a room, to take him to the hospital. And even not the personally, he also felt like, take me to the hospital. Now being rich, there is no means, we say that कि पैसे की कमी नहीं है, सब कुछ है, but फिर भी नहीं बचा पाए, just due to that heart attack. So what is your comment on this? Means how this family or the support system needs to get education in this thing, how you can take immediate action in that moment?
The first most important thing that I see, this should be a four-pronged approach to reduce down the burden of heart disease in our nation. The four-pronged approach, the first one should be awareness. Awareness that heart attack can strike anybody, anytime, and anyhow. So that first thing is supposed to be there in everybody's mind, and that is going to be awareness. Now, awareness about what? Awareness about my heart health. If at all I am aware about my heart health, like for example, how much amount of stress can my heart bear, is some kind of calculation that medical science has come up with. If at all everybody is aware about his own heart health, I'm sure that we will not go beyond in exerting our heart beyond this certain limit. Like for example, when we conduct stress test, we come to know that your heart has a strength of, for example, 7 mets or 9 mets, or a VO2 max of about 35, 30, 25, whatever it is. So if at all you get to know the VO2 max or met value of your heart strength, we can advise you what level of stress can your heart bear, and don't go beyond this before you improve your heart health. This would be the awareness. Second is going to be education. After awareness, if at all awareness stops at this level, fear comes in. And in case of fear, again, Chintana will create problem. So in this case, when the patient gets aware, he is supposed to be educated that if at all his heart health is lower than what is expected, we are supposed to educate him how can you improve your heart health with simple measures that he can perform at his own house without going to any of those doctors. So the second step is going to be educating how can you improve your heart health, would be the second pronged approach for improving the heart health. So the first one was creating awareness. The second one was education about how to improve his heart health. The third one is going to be actual screening of his heart health. Like for example, if at all we normally perform a lipid level of any individual, we'll get to know what is the level of stress that this patient or this person is going through. A typical marker of stress is going to be his total cholesterol level and his LDL, the low density lipoprotein level. If at all the LDL is beyond 150, we are supposed to take into consideration that this person is stressed because of his psychological ill health. He is damaging his blood vessels, due to which the LDL levels are increasing beyond his normal level. So simple screening of lipid profile can help this individual to understand what level of his heart health is he having. So that is going to be the third approach, that is going to be screening. There could be n number of other screening methodologies. There could be a 2D echo, there could be a global longitudinal strain screening, there could be a stress test, there could be a stress thallium, there could be a CT angio, there could be a normal angio. There could be n number of investigations that could be performed to screen what level of heart health does this patient have. And the fourth last important thing is going to be an intervention to improve his heart health. Intervention would be of any style. It could be diet modification, it could be exercises, it could be panchkarma, it could be medicines, it could be herbs, it could be stress management, it could be meditation, it could be yoga. There could be n number of interventions that an individual can perform to improve his heart health. So four-pronged approach to reduce down the whole burden of heart disease in our nation. The first one is going to be awareness, second is going to be the education, third is going to be screening, and fourth is going to be actual intervention to improve his lifestyle. So if at all our nation, our government, our whole scientific industry, if at all follows this four-pronged approach to reduce down the burden of heart disease, I'm sure that nobody in our nation should be falling prey to the heart disease in the coming future.
Exactly. I will remember this now. Awareness, education, screening, and intervention. So easy. So, okay, because I remember I lost my grandmother, in 2012. Sorry, 2012. I'm very weak in remembering those years, but yeah, uh, I lost her, but she had this heart attack prior to 10 years before, when she had first heart attack. And that time, since I am aware, I know I am being educated in the medical field, so I am able to just give her that basic, just the first aid treatment, and call doctor, do the ECG at home, and then get her into the hospital. All that things been done, and literally, when she was admitted in ICU, I was crying, and the doctor, I was asking ki, tell me what is the condition, what is the ejection fraction. So doctor told me it's only, her 20% heart is working, and it's very hard to save. Just pray to God. Okay. And I was literally crying again, the another case where, and my nanny is very close to my heart and in our family. So then I started praying and everything. Obviously, medicine worked. But later on, we have, at least we are able to take her at home in a better condition. Somehow she has been saved. And later on, she got again second attack at home. And that was very severe one. I mean, she passed her motion, vomiting, everything she did. Then also, second time also, she has been saved. Just
Oh.
imagine, 20% heart is working, and she got that thing. Now the third time is horrible, means very silently, that was not, I don't know, heart attack or what, but she just passed very silently without having any kind of hospitalization and anything. So yes, education, that you said, awareness, education, screening, and intervention really helps. Okay, sir, doctor. So that took me towards, now let's understand the holistically how we can, ensure that gives, like you already mentioned about all those therapy which is available. But then also, even if now pandemic, which has been, already taken toll, but when I have gone to do research on heart health disease, when that, again and again we read, keep on reading. So the surprisingly what I found is, there are more patients dying with heart health issues than pandemic. That was really surprising data which has been, traced out. And so I felt, no, that means we need to also pay attention on this heart health care. Even if somebody not means celebrity pass हो गए तो ठीक है, मीडिया भी उसके ऊपर चर्चा करती है, वो सब कुछ चलता रहता है. But you being in this particular field, you being promoting since so many years, not only promoting but creating that, recently I read that there is one copyrighted things which you have developed, that is, sir, Shuddhikaran. Sir, what that name? Please help me out. Can you explain what is that?
Okay. That is a Panchakarma procedure that we had developed. Normally, what happens is, as you just mentioned about your grandmother, that she had a weak heart, and her ejection fraction was below 20%. So such patients who have weak heart, who have less pumping power in their heart, all those patients who normally feel breathless while walking, while climbing up the stairs, many of these patients feel breathless while even lying down on the bed. So all these patients have weak heart and have very, very weak pumping power in their heart. Now, in such cases, we need to improvise their heart functioning to a certain extent. And if at all we improve the function of their heart to a certain extent, their quality and quantity of life both increase many folds. Now, how to do that? So we had copyrighted this procedure called Sampurna Hriday Shuddhikaran, which is now been labeled as heart failure reversal therapy, which normally helps to improve the function of the heart. This is a Panchkarma therapy, which has been explained in Ayurveda since a lot amount of years, and we have coined it as heart failure reversal therapy. And this consists of 4 steps. The first one is Snehan, that is a centripetal kind of oleation that we have a typical preparation, an oil preparation, which we normally massage to the whole body towards the heart, that is a centripetal direction. So that is the first process called as Snehan. This Snehan helps the individual to improve venous return from the lower limb to the heart, so that the blood which was stagnant in the lower limbs will drive this blood towards the heart, due to which the blood, if at all it has been stagnated in the lower limbs, the heart would not get its reserve of blood supply, and that would lead to n number of problems. When we aid this blood from the lower limbs to the heart gets back its own blood supply, which it starts improving in its own supply, as well as it starts pumping the blood to the extent. Now, along with this, now this is a plus point that we have driven the venous return towards the heart, but at the same time, there is n number of excess amount of fluid content in this blood, as well as n number of excess amount of salt content in this blood. This is to be driven out of the body to keep the body lean, to keep the body with less amount of fluid overload. In this case, what do we normally do? Is called as Vedan, or else we call it as whole body steam vasodilatation that we perform for the whole body. That is called as Vedan in Ayurveda. This Vedan again utilizes n number of herbs, due to which we excrete a lot amount of fluids from the largest organ of your body, that is your skin, and a lot amount of salt, that is sodium chloride and water. Once this has been excreted from the body, the excess amount of fluid overload that was there in the body reduces down, thus reducing down the burden on the heart. The third process in this is called as Riddhara. We hold a decoction of a certain herb on the precordial level on the chest, which helps improve the circulation of this blood supply towards the myocardial muscles, as well as it improves the circulation to the intercostal muscles. Intercostal muscles of our chest are very, very important to decide whether a person will feel breathless or not. So if at all the circulation towards these intercostal muscles, which are the accessory muscles of respiration, improve, then I'm sure that the patient feeling breathless on walking certain distance will feel absolutely happy and okay to walk for a longer distance also. So that is the third step, that is called as Rudra. And the fourth step that we perform is called as a medicated enema, or else we call it a Basti in our normal science. Herein, we normally infuse about 100 to 200 ml of herbal decoction inside the rectum of this patient, from where this herbal decoction has been absorbed. Few of it bypasses the liver, few of it goes through the venous channel and reaches to the heart in 6 hours. So as soon as these herbs, which are cardiotonic in nature, reach the myocardium, reach the heart in mere 6 hours, the pumping that is being expected to increase, the patient had low pumping power. We have normally used those herbs which are cardiotonic in nature. So they help directly to improve the tonicity of the myocardium. And as soon as the heart starts pumping well, the whole system gets back into action. And this procedure has been performed for about 7 times, maybe 14 times, maybe 21 times, maybe 28 times, as per the severity of the grade of this heart failure of this patient. So this is the first copyrighted procedure that we had performed in the year 2002, where I had copyrighted it. And since then, we have come up with n number of procedures which we have copyrighted and also put on for applying for patents also, in which we include therapies for reversing diabetes, reversing blood pressure, reversing blockages in the coronary arteries, reversing heart failure. We have also come up with thyroid reversal programs. So n number of therapies in Madhavbag are being now copyrighted and applied for patent. And I'm sure that all these therapies, when more and more Ayurvedic physicians start applying these therapies in the future on their patients, this is going to reduce down the burden of heart disease in our nation, sure.
Wonderful, sir. That's really great to listen from directly from you regarding this whole process and panchakarma, but then also it is more focused on the heart. That is what the point which I understood. So let us just ask question to the participant. Means take some question from the participant. I am requesting whoever watching us here, if you have any question, please do write in the comment so that we can take it in the conversation. Meanwhile, I will ask last question from my end. If you are not, coming up with any question, and then we will conclude this session. Okay. So, Doctor, Ayurveda cardiology. This is the the whole new term which I come across when I was studying this Ayurveda. That time, the 20 years back, it was completely different scenario when people talk about Ayurveda. And I was, while studying also, I have doubted that am I really becoming doctor or what, because reading those Sanskrit sutra, learning Sanskrit language completely, in the first year, it's a different experience all about the things process. And I took admission as you know that time, since you don't get admission to MBBS, so you by default you have to go to the things which is available. So like that only I took admission to the BMS. But now after 20 years, now I heard that from the government people who are working, Ayurveda is topmost, field where people first take admission to the Ayurveda, and if sit means they didn't get sit, then they go to the MBBS. So I'm really happy this whole transformation, and through my experience and all that personal things, what I developed this AYG Academy is specifically promoting Ayurveda first, and later on I done this yoga uh, master in yoga science, so promoting that. Y stands for yoga, and then lastly Garbha Sanskar. G stands for Garbha Sanskar. So here, but again I said that you are one of the inspiration behind creating such a kind of innovative things for the next generation. So sir, Ayurveda cardiology, as a you are also entrepreneur, business, one side you are doctor, one side you are creating so many franchises of promoting Ayurveda allopathy together and promoting heart healthcare. So what message would you like to give to the young uh, people who are coming to study this Ayurveda or allopathy, how they can you know go together and help humanity instead of fighting with each other? That is the biggest thing which I want to listen from your end.
Yes. I would always like to advise each and every allopathic physician to understand Ayurveda well. What happens many a times is an allopathic physician like me normally tries to neglect Ayurveda, normally tries to condemn Ayurveda, uh, realizing the strength of Ayurveda, what I've learned in last 20 years. I could see that Ayurveda is like McKenna's gold. It is like something which is a hidden treasure. And the more you get inside the cave of Ayurveda, the more you realize that it is so strong as a science as a whole. Because I'll just try to mention you, when I was in my college days, I used to read William Hurt, The Heart. That was a 5,000 page book which I used to read because I was a passionate student related to cardiology since my college days. And when I used to read the William Hurst, the Heart book, what I would realize after passing my MBBS, after learning Ayurveda was n number of things which were quoted in this William Hurst are already there in Ayurveda. Like, for example, a two-lined shlok in Ayurveda, like it is saying that तुषयन्ति रसदोषा विगुणातं हृदयं गता नाना बाधा प्रकुर्वन्ति रुद्रोगं तं प्रचक्षते. This simple slok in Ayurveda has mentioned everything that William Hurst in his 5,000 page book was trying to mention. And that too so easily that Ayurveda has made things very, very simple. Like allopathy is still trying to struggle with the solutions for heart disease, Ayurveda is already there with ready-made solutions for heart disease. I would always suggest each and every allopathic physician, each and every homeopathic physician to read Ayurveda once, so that we would understand how are we supposed to apply all these sciences together. If at all you see the difference between Ayurveda, homeopathy and allopathy, there is no difference. I consider them as Vishnu, Mahesh and Shankar because what we need to understand is all of these gods have the same job profile of guarding the whole world as a whole. In the same context, Ayurveda, allopathy and homeopathy also have the same job of guarding the health of each and every individual on our earth. So, whenever an allopathic friend of mine starts asking questions about whether allopathy is good or Ayurveda is good or homeopathy is good, I just mention them the same thing, that if at all you ask about any herb, like we'll take an example of Arjuna, Terminalia Arjuna, if at all we extract the active principle arjunolic acid, it becomes an allopathic compound. Like, for example, you every must be knowing about reserpine, the anti-hypertensive medicine which was banned in allopathy because of its strong anti-hypertensive action. So that same reserpine, if at all it was being extracted from sarpagandha, we could see that reserpine was utilized in allopathy as an allopathic drug. The same reserpine as sarpagandha has been used in Ayurveda, and the same Rauwolfia serpentina has been used in homeopathic preparation as a tincture. So as a whole, nothing is different. It is the same herb which is being transferred into allopathy, Ayurveda, and homeopathy. So as a whole, what is being the basic driving force is nothing else but the nature itself. So one doctor who wants to actually improve the health of the patient, he has to have a knowledge of allopathy, Ayurveda and homeopathy, all of these things, and try to integrate these sciences together as per individual's confidence and knowledge, and try to utilize the best science at the best time for the best patient. If at all that has been performed by each and every doctor in our nation, I'm sure that no patient will suffer any kind of problems in his whole life. So that is how one can integrate Ayurveda, allopathy, and homeopathy to make our nation very, very healthy.
Lovely. I love that Brahma, Vishnu, Mahesh, analogy to give given to this allopathy, Ayurveda, and homeopathy. Yes, that's about the medical field or people who are working in the medical field. So I think we didn't have any questions. So uh, just last message, what you would like to give to common people. Uh, Last message, what do you want to say or guide them how they can take care in day-to-day life, daily life. In Ayurveda, we have dinacharya and then rutcharya. So, like that, if you have any message to give them.
Okay. A simple message from my side to keep your heart healthy, as I spoke in the beginning of this series session also, that just keep your mind healthy. If you keep your mind healthy and free of stress, stay in today, neither in yesterday nor in tomorrow. If you stay in today, your mind is going to be absolutely healthy, free from all the diseases. As it has been mentioned in Ayurveda, that Rudayam Dvam, Tathasthite, Deyam cha Deyam cha Vakshasovantaram. So what has Ayurveda tried to mention is, there are two hearts, one is in over here and one is inside the chest. So both of these hearts have a job profile of taking and giving off. So if at all we are supposed to keep this heart healthy, we are supposed to keep this heart healthy. If at all we keep our mind healthy, I am sure that you will be enjoying your life like anything. So, a simple message to each and every youngster from heart, whatever his age is be. A person who wants to be healthy, he has to keep his mind cool in all the circumstances. Whatever is the scenario, whether things go according to you or whether the things go against you, keep your mind stable. If at all you do that, you will be absolutely free from any kind of heart disease, not only heart disease, any kind of disease, and your healthy life is going to give you quality for your life and keep you happy for your whole generation to come.
Wonderful. Actually, life is in the now. That is what you are saying. So, live the life now. And like you said, that, how why heart, I now, understand that heart has actually connection to each and every part of our body. Whereas, when we give more importance to this brain has actually not such a access to each and every part of our body. Brain just take a decision on the basis of the message which it has been received from the those blood nerves, whatever the connection which is there, and it just does decision on the basis of message which has been given to the brain. So if we just look at, so heart is actually the most organ of our body, although our body doesn't think like that. It works with the synchronization, they help each other. All the organs, they don't take credit of superiority, like they always help each other. And I hope this talk will help to many people who will watch later, and currently also whoever has joined. And thank you so much. It's really wonderful talk and conversation happened with you. Naturally, whatever been came, I planned question, but then also there are a lot of things which even I come up with my personal, some story, and you also stimulated a lot of points which is related to heart, and I got that enlightenment. Thank you so much. We will keep
Thank you.
meeting and be with me and support me and
Yeah.
guide me, because I'm always ready to learn from you. Thank you so much, sir.
Thank you.
Bye
Thank
bye.
you.
Take care. Good night. Yes.